Hello everyone, I am Dr. Deepa. Today we are here to learn about the topic soft palate. The soft palate makes up the posterior one-third of the entire palate, which separates the nasal cavity above from the oral cavity below. As the anterior two-thirds of the entire palate is contributed by the hard palate, which is completely bony in nature, the posterior one-third of the palate is formed by what is called as the soft palate. It is named as soft as it is mainly formed by the muscles. As we can see here, this is the section, the sagittal section showing the nasal cavity with the nasal septum and the oral cavity below. We can make out the soft palate, which is pinkish in color, which is directed downwards and backwards. This soft palate is the mucus covered fibromusculoglandular curtain. It is the mucus covered fibromuscular, the glandular curtain which hangs from the posterior margin of the hard palate, which hangs from the posterior margin of the hard palate and is seen extending backwards and downwards into the oropharynx. So this soft palate is the content of the oropharynx. It is present in the oropharyngeal part. This soft palate, as I have told, is made up of the fibrous tissue. It is made up of the glandular component as well as the palate is formed by the muscles, that is the palatine muscles. So this soft palate is made up of three components, that is the muscles. It is formed by the muscles. It is formed by the glands, the mucus glands. It is also made up of the fibrous component. It is also made up of the fibrous component. So hence it is called as the fibromusculoglandular curtain. It is called as the fibromusculoglandular curtain. Moving on to the presenting parts of the soft palate. This soft palate is quadrilateral in shape and it represents the two surfaces and two borders. As we can see here, it is the curtain which hangs down into the oropharynx. The presenting parts of the soft palate. So roughly, if this is the hard palate, anteriorly the posterior one-third is formed by the soft palate. As I have told, out of this entire soft palate over here, this soft palate is directed downwards and backward. So the upper one-third of the soft palate is fibrous in nature. The middle one-third is made up of muscles and the lower one-third is mainly containing the glands. So this is how the palate is formed. This is how the soft palate is formed. Moving on to the presenting parts of the soft palate. This soft palate has got the anterior surface. Yes, it has got here. This is the anterior surface. It has got the posterior surface. It has got the anterior and the posterior surface, and it is also presented by the upper and the lower border. So this is the upper border of the soft palate, and here comes the lower free border of the soft palate. So this is the lower border of the soft palate which is free. And of course there are the lateral walls on the either side. So these are the presenting parts. So there are two surfaces, that is the anterior and the posterior, and also the two borders, that is the upper and the lower border. So the anterior surface of the soft palate is concave, as we can make out here. The anterior surface of the soft palate is concave, directed downwards, and this anterior surface is facing the oral cavity. This anterior surface represents the median raphe along its median plane. When we talk about the posterior surface, as we can see here, the posterior surface is quite convex in nature, and this posterior surface forms the anterior boundary of the oropharyngeal isthmus. The posterior surface forms the anterior boundary of the oropharyngeal isthmus, and also the posterior surface on each side is connected to the tubal elevation. This posterior surface is connected to the tubal elevation of the nasopharynx through the fold which is called as the salpingo-palatine fold. Through the fold which is called as the salpingo-palatine fold. So this salpingo-palatine fold connects the posterior surface of the soft palate with that of the tubal elevation which is seen in the nasopharynx. So this is about the anterior surface and the posterior surface. Moving on to the upper border. The upper border of the soft palate is in contact with the posterior free margin of the hard palate. It begins as the continuation from the posterior free margin. It is attached to the posterior margin of the hard palate along the palatine crest, whereas the lower border of the soft palate is free. The lower border of the soft palate is free enough, making up the uvula. So the lower border of the soft palate makes up the uvula. The lower border forms the conical projection, tongue-like projection, which is free downwards, which is called as the uvula. So this is about the two surfaces and the two borders. There are two lateral borders as well. So the lateral walls of the soft palate are continuous with the wall of the pharynx. So the lateral walls are in continuation with the wall of the pharynx. So this is about the presenting features or presenting parts of the soft palate. The lower border, as I have told, makes up the free conical projection called as the uvula over here. This lower border also represents the two mucosal fold. It also represents the two mucosal folds on either side, which are called as the palatoglossal fold and the palatoglossal fold, which is present in front of the tonsillar fossa, and the palatopharyngeal fold which is seen behind the tonsillar fossa. So these are the two extensions from the uvula, from the lower border of the soft palate. Next, moving on to the composition of the soft palate, as this soft palate consists of the bilaminar fold of the mucous membrane. The soft palate is mainly composed of the following structures, that is the aponuerosis. Other than the mucous membrane, the deeper part of the soft palate contains the aponeuroses, which is called as the palatine aponeuroses, Number second is the presence of the muscles of the soft palate, the palatine muscles, and it also contains, there are around five pairs of the palatine muscles. Other than the palate muscles, the soft palate contains the vessels and the nerves. The vessels and the nerves along with the glands, that is the palatine glands, along with the glands which are named as the palatine glands. So these are the components of the soft palate. We'll look for each component one by one. To begin with, the palatine aponeurosis. This palatine aponeurosis is the fibrous framework of the soft palate. As we can see here, the palatine aponeurosis is nothing but the fibrous framework of the soft palate where all the palatine muscles are attached to it. This aponeurosis, that is the palatine aponeurosis, is nothing but the expanded tendon of the insertion of the muscle tensor valli palatini. So tensor valli palatini towards its insertion makes up the aponeurosis of the soft palate, which is called as the palatine aponeurosis. So this palatine aponeurosis is nothing but the expanded tendon of the muscle tensor valli palatini towards its insertion. So this is about the palatine aponeurosis. The aponeurosis is attached, it is seen to be attached in front. As we can see here, it is attached to the palatine crest, which makes up the free posterior border of the hard palate, and on each side this aponeurosis, as we can see in this diagram, on each side the aponeurosis is continuous with the tendon of the tensor valli palatini muscle, which is seen to hook around, which is seen to wind around the pterygoid hamulus and is seen continuing with the tensor palatini muscle. So this is about the aponeurosis. So the palatine aponeurosis lies deep to the mucous membrane of the soft palate, which is mainly formed by the extensor tendon of the tensor valli palatini. On either side, the aponeurosis hooks around the hamulus, that is the pterygoid hamulus, and later on it is continuous with the muscle, that is tensor valli palatini muscle. So that's all about the aponeurosis, and very important part is that the aponeurosis receives the attachment of all the muscles of the soft palate. The entire mucous membrane of the soft palate, is covered by the non-keratinized stratified squamous epithelium. Non-keratinized stratified squamous epithelium, except the area present along the upper part of the posterior surface. Except the area along, there is an exception of the epithelium, that is except the area along the upper part of the posterior surface, which is lined by the ciliated columnar. This part is lined by the ciliated columnar, as this part is facing the floor of the nasal cavity. So the ciliated columnar epithelium lines the upper part of the posterior surface. The posterior surface upper part is lined by the ciliated columnar. So this is about the lining epithelium of the mucous membrane. The lining epithelium is completely by the non-keratinized stratified squamous, except the upper part of the posterior surface, which is lined by the ciliated columnar. So this is about the lining epithelium. Moving on to the muscles of the soft palate. In total, there are 5 muscles. There are 5 pair of muscles of the soft palate on either side of the median raphe. The very first muscle is called as the levator palatini muscle. Next are the tensor palatini. Then these are the muscles present along the upper surface. The other muscles are the palatoglossae muscle, the palatopharyngeus, and the muscle which is called as the musculus uvulae. So these are the 5 muscles of the soft palate. Moving on to the attachments of the muscles, the very first muscle, that is the levator palatini muscle. When we talk about the origin of this levator valli palatini, this levator palatini muscle takes its origin from the petrous part, that is the apex of the petrous part of the temporal bone. The origin of this muscle, the levator muscle of the soft palate, is from the apex of the petrous part of the temporal bone, as well as the medial lamina of the auditory tube, the medial lamina of the cartilaginous part of the auditory tube. So these are the 2 attachments of the muscle levator valli. Along with these 2 attachments, the few fibers of the levator palatini also takes its origin from the carotid sheath. It also takes its origin from the carotid sheath. So this is about the origin. So the origin of the levator valley palatine muscle is number one from the apex of the petrous temporal, then comes the medial lamina of the cartilaginous part of the auditory tube, and also the fibers are taking origin from the carotid sheath as well. From this point of origin, this levator valley palatine muscle is directed downwards through the sinus of the Morgagni. It is directed downward to reach the palatine aponeurosis. So the insertion of this muscle, levator palati, is over the upper surface of the palatine aponeurosis. As we can see over here, the insertion is over the upper surface of the palatine aponeurosis. So the muscle levator palatini from either side, that is from both the side, the right and the left, acts as a U-shaped sling of the soft palate. Next, moving on to the muscle tensor palatini muscle. Regarding the origin of the tensor palatini, the tensor palatini takes its origin from the following points, that is number one is the spine of the sphenoid, then next comes the lateral lamina of the auditory tube, the lateral lamina of the auditory tube. So the medial lamina of the auditory tube gives attachment to the levator palatine muscle, whereas the lateral lamina of the auditory tube gives attachment to the muscle tensor palatini. Along with these two attachment, the muscle is also seen to take its attachment from the sulcus tubae number one. It is seen to take attachment from the sulcus tubae. Number second is the scaphoid fossa. Scaphoid fossa. This scaphoid fossa is seen along the medial pterygoid plate. It is also seen to take origin from the auditory tube, as I have already mentioned. So in total, the tensor valley palatini muscle takes its origin from the spine of the sphenoid, the lateral lamina of the auditory tube, the scaphoid fossa, and the sulcus tubae. The scaphoid fossa and the sulcus tubae. So there are three Yes of origin. The origin of the tensor palatini muscle is represented in the form of three Yes. Number one is the spine of the sphenoid, then comes the sulcus tubae and the scaphoid fossa. So yes, 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 this is the origin of the muscle, that is the tensor palatini muscle. So this is about the origin. Moving on to the insertion of the tensor palatini muscle. This muscle is seen to get inserted onto the palatine aponeurosis after passing through the origin of the buccinator muscle. So the muscle, the tensor palatini muscle, the insertion of the tensor palatini muscle is over the palatine aponeurosis on either side. It is over the palatine aponeurosis. The tensor palatini muscle, as I have already told, towards the insertion, the tensor valley palatini makes up the expanded tendon to form the palatine aponeurosis. So the insertion is in the form of the palatine aponeurosis after winding around the pterygoid hamulus. So this is about the insertion of the muscle tensor palatini. Next muscle is the musculus uvulae, the small muscle which is called as the musculus uvulae. Each muscle is seen to arise from the posterior nasal spine of the hard palate. This musculus uvulae is seen to take its origin from the posterior nasal spine. It is seen to take origin from the posterior nasal spine of the hard palate, and the muscle is short and it is getting inserted into the submucous tissue of the base of the uvula. It is getting inserted over the submucous tissue of the base of the uvula, whereas origin is from the posterior nasal spine of the hard palate. So this is about the attachment of the short muscle, that is musculus uvulae. Moving on to the lower two muscles, that is the palatoglossus and the palatopharyngeus. The palatoglossus is seen to take its origin from the undersurface of the palatine aponeurosis. As we can see here, the origin is from the undersurface of the palatine aponeurosis, and the insertion of this glossi muscle is over the side of the tongue. As the name itself says, palatoglossus, the insertion of this muscle is from over the side of the tongue at the junction of the anterior 2/3 and the posterior 1/3. So this is about the muscle palatoglossus. Next, the left top muscle, that is the palatopharyngeus, from the palate reaching the pharyngeal wall. This palatopharyngeus takes its origin from the upper surface of the palatine aponeurosis. So, the upper surface of the palatine aponeurosis again gives attachment to the muscle, that is the palatopharyngeus, but at the point of the origin of the palatopharyngeus, the origin is in the form of the two fascicles. The origin of this palatopharyngeus is in the form of two fascicles, that is the anterior and the posterior. Two fascicles, that is the anterior and the posterior fascicles. So the palatopharyngeus muscle arises from the upper surface of the palatine aponeurosis, is in the form of the anterior and the posterior fasciculi, in the form of the anterior and posterior fasciculi, and it is directed downwards to get inserted onto the pharyngeal wall. So the insertion, most of the fibers of the palatopharyngeus is getting inserted onto the posterior border of the lamina of the thyroid cartilage. The insertion is mainly onto the posterior border of the lamina of the thyroid cartilage. The few fibers of the palatopharyngeus are directed backwards to wind around the perseverance ridge to form a U-shaped sling of the palatopharyngeal sphincter. So, few fibers of the palatopharyngeus participates in forming the palatopharyngeal sphincter by winding around the posterior wall of the perseverance ridge. So, this is about the insertion of the muscle palatopharyngeus. So we have completed the attachments of all the 5 muscles here. This is the atlas view where we can make out the attachments of few muscles. As we can see, the attachment of the muscle palatopharyngeus here extending from the soft palate, which is seen extending from the soft palate, the upper surface taking its origin from the palatine aponeurosis. The insertion is directed downward to reach the posterior border of the lamina of the thyroid cartilage, as I have already told. So this is the muscle palatopharyngeus seen here. We can also make out the muscle levator valli palatini muscle here. So this is about the muscles seen in this section. Here we can make out the muscle, that is the palatoglossus muscle. This is the lateral view, atlas view, showing the muscle palatoglossus from the soft palate reaching the glossi, that is the side of the tongue at the junction of the anterior 2/3 and the posterior 1/3 of the side. This is the section taken from the base where we can make out the two muscles, the palatini muscle, that is the levator valli palatini, and the tensor valli palatini. As we can see, the levator valli palatini muscle and the tensor valli palatini taking its origin from the cartilaginous part of the auditory or the Eustachian tube. As I have already discussed, the levator valli palatini is taking its origin from the medial lamina, whereas the tensor valli palatini takes its origin from the lateral lamina of this auditory tube. This is the sagittal section of the soft palate where we can make out the structure of the soft palate here, the insertion of the muscles of the soft palate. We can also see here, this is the palatopharyngeal sphincter. We can just see, as I have told, the palatopharyngeal muscle, few fibers of this palatopharyngeal muscle, the few fibers of the palatopharyngeus muscle are directed backward to reach the posterior wall of the pharynx and winds around the perseverance ridge to make up the palatopharyngeal sphincter. So this is where we can make out. This is again the picture showing the deeper dissection of the pharynx and the soft palate. As I have told, the palate, we can make out the muscles, that is the palatoglossus over here, the palatoglossal muscle. We can also make out the palatopharyngeal muscle here, along with the deeper dissection showing the arterial supply. Regarding the actions of all these five muscles, when we talk about the levator valli palatini muscle, the levator valli palatini muscle mainly brings about elevation of the soft palate. It elevates the soft palate and assists in the closure of the phalangeal isthmus. The next muscle, that is the tensor valli palatini muscle. This tensor valli palatini muscle is involved in the depression of the anterior part of the soft palate. So the action of these two muscles bring about the closure of the pharyngeal isthmus, the closure of the pharyngeal isthmus. So this is about the action of the two palatine muscle. Next is the palatopharyngeus muscle. The palatopharyngeus muscle, as it is also the muscle of the pharynx, this palatopharyngeus muscle is involved in the elevation of the larynx and the pharynx. So the contraction of this muscle brings about elevation of the larynx and the pharynx. Next is the muscle reaching the tongue, that is palatoglossus. The palatoglossus muscle, the contraction of this palatoglossus muscle brings about elevation of the base of the tongue. It elevates the base of the tongue, thus helps in closure of the oropharyngeal isthmus. The elevation of this base of the tongue brings about the closure of the oropharyngeal isthmus. The last small muscle, which is the musculus uvulae. The musculus uvulae muscle, the contraction of this musculus uvulae muscle pulls the uvula forward to its own side. So it pulls the contraction of this muscle pulls the uvula to the same side. So this is about the actions of all the muscles of the soft palate. Moving on to the very next, that is the blood supply. The blood supply of the soft palate. The arterial supply of the soft palate is by the palatine branches of the artery, like that of the arterial supply is by the palatine branches. They are by the palatine branches of the maxillary artery, the facial artery, the palatine branches of the facial artery, as well as the branches of the ascending pharyngeal artery. So the palatine branches, that is the greater palatine branch of the maxillary artery, the ascending palatine branch of the facial artery, and the branches of the ascending pharyngeal artery bring about the vascular supply of the soft palate. Regarding the venous drainage, all the veins, the venous blood is drained through the plexus, that is the pharyngeal venous plexus. So the venous drainage of the soft palate, is into the pharyngeal venous plexus, So this is about the blood supply of the soft palate. Moving on to the nerve supply of the soft palate. The nerve supply of the soft palate. So in the nerve supply of the soft palate, we have the motor nerve supply and the sensory nerve supply. So the motor supply of the soft palate is brought about by the cranial part of the accessory nerve. So the motor supply is by the cranial part of the accessory nerve, the cranial part of the accessory nerve, except one muscle, so there is out of the five muscle, all the muscles are supplied by the cranial part of the accessory nerve, except the muscle tensor valli palatini muscle, except the muscle tensor valley palatine muscle. This muscle, the tensor valley palatine muscle, is supplied by the direct branch from the trunk of the mandibular nerve. It is supplied by the trunk of the mandibular nerve through the otic ganglion. So this is about the nerve supply or the motor supply of the soft palate. Moving on to the secretomotor fibers. Secretomotor supply to the palatine glands. The preganglionic fibers. The preganglionic fibers, they begin from the superior salivatory nucleus of the pons. From the superior salivatory nucleus through the facial nerve, the fibers reach the greater petrosal nerve, and through the greater petrosal nerve, the sensation is relayed into the pterygopalatine ganglion. It reaches the ganglion, that is the pterygopalatine ganglion. So the postganglionic fibers from the pterygopalatine ganglion, reach the palatine glands, through the palatine nerves, that is the greater and the lesser palatine nerves. So they reach the palatine glands through the palatine nerve. So this is about the secretomotor pathway. So the secretomotor pathway is from the superior salivatory. The preganglionic fibers is from the superior salivatory nucleus and pass successively through the facial, the greater petrosal, the nerve to pterygoid canal, and they reach the pterygopalatine ganglion. So the postganglionic fibers from the pterygopalatine ganglion reach the palatine glands by passing through the palatine nerves. So this is about the secretomotor sensation. So secretomotor supply. The sensory supply is by the ninth cranial nerve, that is the glossopharyngeal nerve, which supplies both the special sensation and the general sensation. So this is about the arterial supply, the venous drainage, and the nerve supply of the soft palate. So this is the end of the today's video. So we have studied the soft palate in detail today. So we have studied the soft palate under the presenting parts, the muscles of the soft palate, the attachments of the soft palate in detail. We have also looked onto the nerve supply, the blood supply, and the lymphatic drainage of the soft palate in this video for today. Thank you.